Hello, I'm Peter Zanoni, Corpus Christi City Manager, and we're coming to you today with another update on our health district business model update or revision. We had been meeting in person since October, but this will actually be the fourth video that we're providing to you. And we know we're doing this because of the surge in the Omicron variant. Some good news, though, is that the cases in the last couple of days have been about 1/3 of the highest case count we had, which is over 1,500. So we're right under 500 cases, new cases a day. But we know that you're still busy addressing the community needs, and so instead of meeting in person, we want to provide you this video update so that you can go about your business and hear this at your convenience. So today we're going to cover just two topical areas. One that I thought would be important to go over with you is the business model, the prevailing business model that we're focused on right now, we being myself, my transitional team, and the mayor and city council. We know that they met this week and they passed 9-0 a motion to use one of the business models, or to focus more on one of the two business models that we've been looking at. And that business model that they voted 9-0 to consider is the city-led health district. So I'm going to go over the deal points, or kind of the current contract with you in this message today. And then I also want to give you an update on the comments that you have been leaving us. We know that we have two drop boxes, one at City Hall and then one at your building. I want to share some of the comments with you and encourage you to continue to utilize that. We also have the online portal that is anonymous, and that's another way you can comment to us. So those will be the two updates for today. Let's go over the prevailing business model that we're considering. As I mentioned, we had to, City Council initially approved a city-only health department, and then the health district would remain with Nueces County. However, based on Commissioners Court input and suggestions, they asked that we reconsider that model and consider one where the health district pretty much stays intact, but there would be a one-party operator, and that would be the city. Of course, there'd be other changes as well, but the City Council this Tuesday endorsed that model, and so that's what we're focused on. So I want to go over the deal points in that model with you. This week, there are several comments and questions that came in from the health employees, and so I want to make sure you understand this business model, because this is the one that we're moving forward with analyzing, with developing, and it will still need City Council approval ultimately, as well as the Commissioners Court approval. But I'm going to bring you up to speed to let you know where we are at the negotiating table with Nueces County. And so before I get too much into the contract, I did want to remind us again, as we do each meeting, to stress the reasons why we're moving to a new business model, and that is that we and you, the City Council, and I believe the Commissioners Court are focused on three things. That is, one, better health outcomes for our community. Our public health district is a key service provider in helping achieve those goals. Secondly, we want to make sure we're mindful and better utilizing our taxpayer dollars that go to public health, and that includes grant dollars. Even though they're federal dollars or state dollars, it's still tax dollars that you and I pay, and so being more mindful and using our tax dollars better, more efficiently, more effectively is our second goal. And we know our third goal is a better work environment for you, the employee. We know that in the past 2 decades, there have been over 4 studies, each of which have been done independently, but they all had the same conclusion, that being that the health district's work environment, the workplace, is not optimal. It's not the best that it could be, and so that's a key focus area that we have had. So those are the 3 goals: better health outcomes, better use of taxpayer dollars for public health, and then a better work environment. Those goals are focused around another key concept, and that is no interruption in service to our community. That includes the city of Corpus Christi, that includes unincorporated Nueces County, and that includes other communities in Nueces County like Robstown or Banquete or Alduce. And so those are our goals that we have and that you have as well. Let's begin by going over the deal points that are in this current contract. We know that I had spoke about a 3.5-page document. Our legal teams, both the cities and then Nueces County's Jenny Dorsey, who's the county negotiator, she's also the county attorney, have developed these terms of what we're considering now a contract amendment to the current contract that guides the health district. So the first thing is organizational structure, and this is a critical point or key point in this concept. So the health district would have two entities, the city and the county, just like today, but very different than today is that the city would be the exclusive operator. We would be 100% in control. That means that the city would appoint or hire all employees, and we would direct the work of all those employees. We would evaluate all those employees as well. And so that includes the health director, that includes the assistant health director, the division heads, and then all the staff that report to that leadership team. And so that's a key thing. There were some questions about that this week. So all employees, with the exception of a few that I'll highlight in a moment, will be city employees, and they will take the direction from the city for the health district operation. So there are a few employees through the negotiating with the county-appointed negotiator, Jenny Dorsey, who are close to being vested with Nueces County. They're about 2 years away from vesting, meaning their match money and their retirement plan is 2 years away before they can be eligible to secure it. And so we agreed that those employees, there's only about 4 of them. If we hire them through the interview process, they would actually remain on the county's payroll so they can become eligible for vesting and get that retirement dollar match money. Those employees would stay as county employees for that 2-year period, but they would report to, be directed by, and essentially be city employees. And so that's an important thing on the organizational structure. Another key thing is that the health district would essentially be reorganized. And so every employee today would move from their current position to a new position through what we know to be our interview process that's happening. That includes all positions, the director, the assistant director, the division heads, and the frontline employees. So every employee would be reapplying for their job and be selected, hopefully, by the city team. That includes some external interview panel members as well. And they would then become part of the new health district. Now, one key thing, and this question came up early on when we were meeting back in October, is that county employees who are with the health district today, they would equally be able to apply for the city posted positions. And so we know that for many of the positions we're posting only internally, and that means internally to the city employee and the county employee. So Nueces County employees who are health district employees today will have that right or that opportunity to apply for postings that we do that are deemed to be internal only. So that's an important part. Now, another benefit to the county employee, the Nueces County employee, and I must say that Jenny Dorsey, the county appointed negotiator, has done a real good job with the Commissioners Court input on getting some real good value-added concepts in this contract for the county employee. And so many county employees have sick leave and vacation time accrued, and if you were to leave the current county position and come to the city position in the health district, there would have been a chance that you would forfeit or lose that sick leave and vacation leave. And so through our negotiations, we put in the contract that sick leave and vacation leave would transfer to the city, as well as a payment from Nueces County for the value of both the sick and the vacation leave. And so that's a real good benefit for the county employee that would come to the city in this new business model. Now, we know that the city would run exclusively the health district. Nueces County would still be a entity in the health district or a member or a partner. And what the county's main function would be in the new district is that they would ask for annually services to be provided by the health district. And in lieu of those services that we would negotiate, there would be an agreed upon payment from Nueces County to the city, essentially to the health district, to pay for those services. And so annually, the city and the county would negotiate a list of services to be provided in the health district, and then that payment would be negotiated as well. And we know that across Texas, that often is a sticking point or a point of contention, and sometimes the two entities can't move beyond a negotiating point. And so in the contract, we state that by July 1 of each year, the terms of or the service levels as well as the payment amounts need to be confirmed by both parties so that we can budget them appropriately to begin those services on October 1. So July 1 is kind of a trigger date. If we can't reach consensus or conclusion, then the city health district won't provide the services essentially. And so that's really just to benefit both parties with some certainty We know that in the current negotiations that we're having with Jenny Dorsey, there's a high level of professionalism. We don't think that we'll get to this point where we would have to not provide services after July 1, and so we hope that the county will continue to have that high level of professionalism. We think that between the city and the county each year by July 1, we can come to terms with what services to provide and then also what would be the payment amount. Now, we know that the health district has about $5 million between city and county general fund, but we also know there's a substantial amount of grant funding, especially with the COVID pandemic, that the health district receives today. And we know that in the new business model, one of the things we heard loud and clear from the employees and our partners in the community is that we're leaving a lot of grants on the table, so to speak. So we hope to be applying for many more grants. And so even though today's level of grant funding is high, we expect it to continue to be at that level even after the pandemic begins to ease in our community. So on grants, all grants that exist today would be transferred to the city in this new model. So any city grant would transfer to the city. Any county grant that's assigned to the county under the health district, that also would transfer to the city. There would be a financial transaction on both sides. So the county would be responsible to either assign, reassign, transfer, or forward to the city any grant that's assigned to them effective upon the effective date of the new model, and I'll tell you that when that date is here momentarily. So the grants are pretty important. We know that all grant positions, just like the general fund positions, would also become city positions, and so even a grant employee will have to reapply and interview for their job. Okay, now the current contract, as I'm calling it, because we've moved from the deal points and have placed this into an actual contract that's actually now 8 pages. One of the terms in the contract that's being proposed to both the city and the county is that additional services would be provided to the county, to Nueces County. We made the pledge early on that there would be no interruption in service, and that's been a great pledge that we're adhering to. Another one, though, that the county asked for is even more services. And of course, our number one goal in this whole transition to a new business model is better health outcomes. And so what better way to do that than to provide better and more services to even more people? And so in the contract today, there's additional services that would be provided, and the county would pay for those services. That includes opening a clinic at the Calderon building in Robstown, Texas. And so that building needs to be finished out for a clinic, but the contract states that twice a week we would open a clinic with health district employees in Robstown at that Calderon clinic. That'll provide much needed health care services to that population in the Robstown area, making it more convenient rather than having to travel down here to the city of Corpus Christi. Another improvement in here is that the city health district would operate a mobile health clinic, essentially a mobile bus. That vehicle is in today, Nueces County owns it. It's not operated as much as the county hopes for, so in this new business model, the health district would provide services via the mobile bus into the Nueces County community twice a month to begin with. I know the Commissioner's Court through Jenny Dorsey have asked for maybe up to 4 times a month. Right now we're saying let's at least get 2 times a month, and we can see if we want to change that for the next fiscal year, October 1. But there's a lot to do in the transition, and so I think the more we graduate into service levels, the better, and so we're recommending twice a month we'll provide services with the mobile clinic. Now, another important thing for some is the name of the district, and so through both the city and the county negotiating team, the city council and the Commissioner's Court, both parties are in agreement, I believe, at this point, to keep the name of the health district the same, and so it would still be called the Corpus Christi Nueces County Health District. However, Nueces County is okay with the recommendation from the City Council, which is that the city in the near future may change that name to better suit the new operation. We would consult with the county before that's done, but the city does have the ability in the future to change the name based on employee input and community input as well. Now, one key thing that is newly added that the Commissioner's Court will be reviewing today through their attorney, Jenny Dorsey, is a recommendation of the City Council, which is to do a review of this business model. It would be a mandatory review within 2 years. And so we've listed it as a sunset review, but the sunset would happen only if the business model or the service delivery isn't optimal. And so I believe that's a really good ad. So we're saying that we're going to go with this new business model, but within 2 years, there'll be a mandatory assessment of it to see, one, is the business model working, and then two, is the service levels improved in the community. And so that review would be an official report that would be provided to the City Council, and the determination would be made at that point to either continue the model, maybe to modify it, or to abandon it altogether. And so our contract that we have that we'll be presenting to the Commissioners Court does have that additional provision in there. And I think that's a good one. It eliminates complacency, keeps innovation in the forefront, and gives us the thought that, or the business plan that we're going to review this in 2 years to see is it working as we had hoped. Now, one final thing is the effective date, and so we're recommending that this new business model of a health district that is run exclusively by the City of Corpus Christi be March 1 of this year. So March 1, 2022 would be the effective date for the new business model. That is the overview of the contract terms. There's obviously a little bit more in here, but those are the key elements. It's an 8-page document, as I mentioned. It's available. We have provided it to the City Council. It's been provided to Nueces County Commissioners. And so I just went over the highlights with you to make sure you know what we're recommending to Nueces County and what the Nueces County is recommending for us as well. And so the path forward then is what I'd like to cover with you finally on this, and that is City Council meetings and Nueces County Commissioners Court meetings. Both governing bodies ultimately need to approve this contract, and both governing bodies have been negotiating it and going back and forth with some changes and amendments, and I believe the process has been very professional, and it considers, or it keeps, I think, at the heart of it all, the community. And so I think we want to applaud both governing bodies for focusing most on that and not other things that they could focus on. So City Council's next meeting is February 8th, so not next Tuesday, but the following Tuesday. That will be the next time the City Council will have the opportunity to look at this contract, February 8th. City Council has one more meeting, February 15, that following Tuesday. And that pushes us close to February 17, which is the current withdrawal date if we exercise that option to withdraw completely from the district. The next County Commissioners Court meeting is actually this coming Tuesday. So this coming Wednesday. Next week, Wednesday, Commissioners Court will meet. That's February 2nd. What we're recommending to Jenny Dorsey today is that the Commissioners Court consider adding a special meeting on February 9. That would be the following Wednesday. That would place that meeting one day after City Council's meeting on February 8th. And so we think that if City Council agrees with the terms of the contract, if the Commissioners Court accepts some of the amendments, or all of the amendments, I should say, that they approved this past Tuesday, then we believe that City Council is in a pretty good position to consider for adoption the contract on February 8th. If Nueces County considered doing such, they could schedule a separate meeting or special meeting on February 9th, and then they could, a day later, adopt the contract as well. And so we would be very secure in having a new business plan then adopted by both parties well before the withdrawal date of February 17. And so we're working with Jenny Dorsey, the county attorney and county appointed negotiator, on this schedule. We think it's one that might be favorable to Commissioners Court. It works well with the City Council, and we believe it works well with you as well, the employee. And then finally, in today's presentation to you, we just want to cover and go over a quick update on the employee comment cards. And so you, the city employee, asked that we make this available to you. It's a way for you to communicate with us. We have 2 comment boxes or suggestion boxes at your recommendation. One is at your health district building, and then one is at City Hall. And we also have our online portal. And so this week and the last week, we received about 9 comment cards with about a dozen different comments. And in the past week, these comments all generally focused around one theme, and that is that you all, the employee, want a better work environment. And we agree, and we think that the numerous studies that have been done in the past 2 decades also expressed that as well. And so we want to let you know that we're looking at the comment cards. Your input to us and comments and suggestions are a valuable part of the transition and us developing a business model that is suitable for you and the community. There was one comment card that I liked in there that said March 1, which would be the effective date we're recommending for the new business model, is too late. And you said, let's start even sooner. And so I like that because I believe that every day that goes by is another day where we're not providing good health outcomes or most optimal health outcomes. We may not be utilizing taxpayer dollars most wisely, and our workplace environment is not where we want it to be. So we're working hard to get to that March 1 timeframe. We think that is an optimal one. And again, we appreciate your comments and the comment cards. Continue to leave them. We check them a couple times a week, and we'll continue to provide you feedback after you submit them. Okay, so City County Health employees, we want to thank you again for tuning in this week with this digital presentation to you. As I mentioned, we hope to be in front of you again. Just some closing comments as the calendar, and so we know that Nueces County Commissioners Court will be meeting this coming Wednesday, February 2nd. The next City Council meeting is February 8th, and then February 15th would be the final one before the 17th. We're recommending through Jenny Dorsey, the county negotiator, that the Commissioners Court consider scheduling a special meeting on Wednesday, February 9th, so that they could follow up upon City Council's actions if on February 8th, City Council approves the current contract. We know that public health is critical every day, but especially these last several years with the pandemic, it's even more so. We want to thank you for what you're doing. We look forward to concluding the work that we have done to develop a new business model, and we want you to be part of that new business model where we're providing better health outcomes to the community. We're utilizing our taxpayer dollars better, and most importantly for you, we have a much better workplace and work environment. So thank you, stay safe, have a good week, and we'll see you next week.